Hello, I am Zachary Mead, and today I'll be presenting on the association of age and antipsychotic medication and the severity of schizophrenia with proton magnetic resonance spectroscopy as it relates to brain glutamate levels. So, a little introduction. The purpose of this study was to examine the clinical and demographic factors and associated with brain glutamate or plus glutamate, known as GLX levels, as it relates to schizophrenia. And to do this, they assess the associations of age and symptom severity of level of functioning of antipsychotic treatment with glutamate metabolites. Altogether, they examined the medial frontal cortex of the glutamatergic metabolite levels that were lower in patients and negatively associated with the dose of antipsychotic medication, although a reduction of glutamate levels with age was not accelerated in patients with schizophrenia compared to healthy individuals. In the study, they also found that a higher medial frontal cortex and medial temporal lobe glutamate levels were associated with more severe symptoms in patients with schizophrenia. This is important because lower brain glutamate levels may be associated with antipsychotic exposure rather than with greater age-related decline, whereas a higher glutamate level and may be severe as biomarkers of illness of schizophrenia and severity in patients with schizophrenia. Two things to add to this. So in previous studies, they indicated that altered brain glutamatergic function may be associated with pathophysiology of schizophrenia in the response of antipsychotic treatment. The association of altered glutamatergic function with clinical and demographic factors is still unclear. So a little bit into the methodology, and we'll get a touch on the data a little bit that was taken up during the study. So this study focused on 1,251 patients with schizophrenia and 1,197 healthy volunteers. Participants were found via a database and searched to identify journal articles that were published between January 1st, 1980 and June 3rd, 2020. So the following search terms were magnetic resonance spectroscopy, and had to have one of the following on the screen. The bigger ones would have been schizophrenia, psychosis, and ultra-high risk. But all of the ones above were searched for. So it's also to point out that they also focused on measuring glutamate levels in patients with schizophrenia. They also viewed it in patients without schizophrenia. The different levels they looked for was 45 studies that contributed to the data, and they looked through 45 and they only included 42 in the final results. So the result and the conclusion. So glutamate levels were lower in patients that were the healthy volunteers, although creatine levels appeared to be lower in patients. The difference was not significant. Patients and volunteers had a glutamate level negatively associated with age. Patients with antipsychotic dose of chlormazepine equivalents, so this is a drug that's commonly used in schizophrenia, was negatively associated to the glutamate. So glutamate or creatine ratio is also positively associated with the total symptom severity, and GLX and creatine ratio is also positively associated with the total symptom severity. Of this, creatine levels increased with age, but did not associate with either symptom or severity of the antipsychotic medication. So this study suggests that lower glutamate levels in patients with schizophrenia may be associated to antipsychotic medication exposure rather than with a greater age-related decline, which might help us understand the mechanisms of schizophrenia better. So the clinical applications for this is clinically, they can be used to diagnose and pre-diagnose schizophrenia, which is currently still in effect. But it just kind of furthers the knowledge that we know on this. Because of the high brain glutamate levels, many act as biomarkers of the illness, and also to let us know the severity of the illness being schizophrenia. This is my reference. Thank you very much for listening.